Hello, my name is Carolina and this is the oral medication administration skills video. Some of the items that I need for this video are the medication, Tylenol, hand sanitizer, and clean glove. So the first thing that I need to do is verify the healthcare provider's order, verify the 6 rights of medication administration, the right patient, right medication, right dose, right route, right time, and right documentation. Next, I will compare the medication order in the MAR. I will calculate the right dose of medication, and I will check the medication 3 times for safety prior to removing it from the drawer, comparing it to the MAR and at the patient's bedside. I have picked MAR number 3 and the prescribed order is amoxicillin 250 milligrams, metformin 500 milligrams, Benadryl 25 milligrams, and Tylenol 500 milligrams in 15 milliliters. So I'm going to enter the room, close the door for patient privacy, perform hand hygiene, and introduce myself to the patient. Hello, Mr. Lakes. My name is Carolina. I'm going to be your nurse today. Next, I will ask the patient for his full name and date of birth, and those are the 2 patient identifiers. Also, I will ask the patient if he has any known allergies to medication, food, seasonal allergies, or other, and in this case, the patient denies any known allergies. So I'm going to perform hand hygiene, apply clean glove, and at the patient's bedside, I will compare the MAR with the name of the medication and with the patient's name. Prior to administering and preparing any medication, I will do a pre-administration assessment. In this case, I will ask the patient to rate his pain level from 0 to 10, given that I am administering Tylenol. Now I'm going to teach the patient about each medication. Okay, Mr. Lakes, I'm going to teach you about each medication, and I want you to know that the common side effects, those are very common, but the adverse effects, if you experience any of those, please let me know right away so I can notify the healthcare provider. So this is amoxicillin 250 milligrams. This is an antibiotic to treat bacterial infections. Some of the side effects are nausea, diarrhea, and vomiting. Some of the adverse effects are high difficulty breathing and swollen throat. This is metformin 500 milligrams. This is for high blood sugar in type 2 diabetes. Some of the common side effects are low blood sugar, nausea and diarrhea, and some of the adverse effects are slow heart rate, difficulty breathing, and unusual muscle pain. This is Benadryl 25 milligrams. This is to treat allergy symptoms. Some of the common side effects are drowsiness, dizziness, and loss of coordination. And the adverse effects are pounding heart rate, difficulty breathing, and tightness in the neck. This is Tylenol 500 milligrams in 15 milliliters. This is to treat short-term pain relief. Some of the common side effects are stomach pain and nausea, and some of the adverse effects are jaundice, dark urine, and clay-colored stools. And I will allow the patient to ask any questions prior to administering his medication. In addition, I will make sure that the patient is in a comfortable position. I will make sure that if he wants to be sitting or sidelined. Also, I will offer him his preferred drink as long as it is compatible with the medication. And if the patient wants to take his own medication, that is time. Sometimes they want to take one at a time or all of them at the same time. Now I'm going to offer him the Tylenol. I will place the measuring cup in my flat surface, and I will gently shake the medication to mix it, and I will hold the medication covering the label with my hand. Remove the lid and place the lid upside down on my working surface, and I will get down to an eye level to administer the medication. Next, I will wipe the neck of the bottle. I will place the lid on. And I will show the medication to the camera so you can see that I have measured the 15 milliliters. And again, I will offer the medication to the patient with his preferred liquid. Okay. After administering the medication, I will make sure that the patient is in a comfortable position. I will lower the bed to the lowest position. I will raise the side rails. I will make sure that all his personal items are within reach. Handle him the cold light and make sure that he knows how to use the cold light. I will tidy the room, clean up, throw everything to the proper receptacle, remove my glove, throw the glove to the proper receptacle, perform hand hygiene, and I will go and document the procedure. Thank you.